Is on the way to healthcare in southern Niagara County. Starting at midnight Saturday going into Sunday this weekend, the emergency department will close at Eastern Niagara Hospital, which is closing down, and it's going to move to this site on South Transit. It's the current ambulatory surgery and urgent care center. The imaging and other services there will also continue, including the labs. Catholic Health will operate the ER at this site temporarily while waiting on the Mount St. Mary's Hospital, the brand new one, the branch, to open in Lockport in a few months. I talked about all of this and what people should know with Mount St. Mary's Hospital's president, CJ Urlaub. We certainly appreciate you taking some time for us here because I know how busy it is right now. You're literally just hours from making this big switch over. What should people in Niagara County know about what is going to change in a little more than a day?
Well, we are so pleased to be here in South Transit Road in Lockport. We are at the old Eastern Niagara Ambulatory Surgery Center and Urgent Care Center. And what we're doing here today, as we've basically got about 36 hours to pull this thing off, we are converting the urgent care into a complete emergency department.
This facility currently is known as the Ambulatory Surgery Center and the Urgent Care Center. This will just sort of transform the space, right?
Yes, we had an orientation this morning of all the staff that will be joining us on the ambulatory surgery side, and they will open for business on Monday morning, just as usual, but now part of Catholic Health and Mount St. Mary's. And then what we've done is we've taken what the community knows as the urgent care side, and that's where we're totally converting it into an emergency department.
This is a temporary thing, right? Until you get the new facility up and running.
Yes, it is. With Eastern Niagara's closure this weekend of their hospital and emergency department, it was going to leave a gap of about 3 months before Mount St. Mary's will be able to open our new hospital here in Lockport. So the local elected officials worked with the state, and they approached Catholic Health and Mount St. Mary's and said, hey, we need to do something for the community. Is there any way you could create an emergency department? So we looked at it. We looked at the new asset that Mount St. Mary's has in a urgent care and said, you know what, with our partners from UBMD, we're going to convert this thing. We've worked with the Department of Health and the state of New York Joint Commission, gotten very great cooperation from the community. Everybody's pulling together. There's this need. Without it, there'd be a real hole for emergency services here in this part of the county.
Yeah, I wonder what you would say about your many employees and outside partners. As you mentioned, so many people have come together.
Right.
This from a layperson sounds like a very daunting task.
It truly has been, but I'm so proud of the team and the way really Catholic Health from all over, all aspects, whether it was IT, imaging, laboratory, all these folks with these specialties have all come together, and they're bringing these specialized knowledges, and we're just stitching it together, and we're going to be ready.
While we have you, what update can you provide for us on the Mount St. Mary's Hospital and how it's progressing toward that opening, just months away?
It is just months away. I'm actually heading over there after our conversation here. We're going to do a walkthrough, making sure we got any last minute things here. And then I'm heading over to the Lockport Hospital. Every time I go in, we're seeing enormous progress. It's really thrilling. Walls are up, ceilings are going in, equipment's starting to show up. We're staging various furniture and all in trailers. We're ready to go. We hope to have our team in there sometime in August, working side by side as they're doing the finishing touches so that we can be ready to care for the patients. You can't pin me down to a date just yet, but we are working our hardest to be there by mid-September.
Well, CJ, I know it is just an incredibly busy time for you right now. Thanks for taking a moment to update our viewers on how this is progressing and what will change this weekend.
Mike, thanks for the interest and I appreciate our opportunity to get the word out. We're excited to be here.